yourself.
Focusing on health this afternoon on Kababayan today, because health is the truest wealth, our truest wealth. And I hope you have your pen and papers ready, because we are trying to give tips today on the differences between Western medicine, holistic medicine, Oriental medicine, or alternative medicine, so you know what's good for you. Earlier, I posed this question, advantages and disadvantages and comparisons between Western medicine and holistic and alternative. Well, in your opinion, what are those, Maria?
Well, first of all, I would like to say, if you're not feeling well, it's absolutely necessary to go get blood work done.
Okay.
It's a science. So it's a science of combining holistic and Western, because you do need to know where your blood stands.
Okay.
You need to know if you're deficient in different iron or in vitamin D's or B's or any of that stuff. So you need that science background to figure out what that is. There's no other way to find that out except for blood tests.
Okay.
So there are advantages of the Western medicine is that you can fix broken bones. You can do open heart surgery. You can do all of those things that are proactive to keep you, healthy and alive.
Right.
On the other flip side, the reason I like holistic medicine is because when I use essential oils to help with cures of everyday things, there's no side effects really. I mean, unless you're allergic to lavender, I wouldn't use it, but you'll know that. And then if you're allergic to it, you won't bleed out of orifices, you know what I mean? You'll have like some minor skin irritation.
Right.
So it's like something like that you'll know right away, versus something where pharmaceuticals will just, may cause this, may cause that, and your symptoms get worse.
All right, so you're saying holistic plus Western medicine, good combination. What about alternative medicine, Dr. Park, and Oriental medicine? Should we take one over the other? Should we take that over Western medicine? Can one replace the other, or should it also be used in combination?
Oh, depends on the situation. Yeah,
Okay.
Sometimes we can use combination. How can I say? We currently a lot of people using complementary medicine. Yeah, this one is like alternative medicine combined with conventional medicine. It means it's like a Western medicine.
Okay.
So for example, it's someone who has a cancer and they have to surgery. After surgery, some cases have to chemotherapy or radiation therapy, right?
Okay.
But there are a lot of side effects. So there's
chemotherapy, yes, of course, yes, and
they're using very strong medication, so they just lost hair, and then insomnia, indigestion, and lost weight, and the headache, a lot of side effects. At that time, if they already take a lot of strong medication, so in this case, the alternative medicine is like acupuncture or herbal medicine help them reduce this kind of symptoms.
Okay.
Yeah.
Okay.
Yeah.
So, which brings me to also to my next question. Some patients, some people will experience stuff first and go to go to a doctor, Western medicine, and then when there's really like the Western medicine, they can't figure out what's wrong or and so they go to alternative or Oriental or holistic. Should we do one first over the other, or explore holistic and Western Oriental first, and then if there's really nothing going on, then we go to Western medicine? Which one should we try first?
I think it depends on depends on the situation though. How patient what kind of problem do they have?
Okay.
For example, someone who has a spine problem is like a disc problem.
Obviously.
Obviously, someone who has a really severe pain, they just go to emergency or they just find a primary doctor.
Okay.
But actually, they just first time they just got the pain medication and the anti-inflammatory medication and muscle relaxant. After that, they're using injection, and then if it's not working, is they go to the surgery.
Right.
But currently, especially our hospital have a specialty. It's like a spine problem. So before surgery, someone who has a disc problem, we can do acupuncture with the herbal medicine, help their disc problem.
Right. Okay. Which brings me to my next question. How soon after, say Reiki, say essential oils, because medicine sometimes it's 3 weeks before you experience results. How soon after?
Well, interestingly enough, I know somebody who had a back surgery. He actually got crushed by a wave, and when he was out surfing.
Okay.
Yeah, and he had a back surgery, and I saw him just as he had the stitches removed.
Okay.
And he still had the bandages on, so it was actually, like real fleshy
Right.
still. On Percocet, really kind of drugged out.
Right.
We started him on essential oils, and within 2 days, he was off Percocet.
2 days. Wow.
Because of the essential oils were penetrating and reducing the inflammation and pain.
Because also it's natural. It's
And
not
it's natural.
chemically produced.
Exactly.
What about acupuncture?
So acupuncture is usually people know about acupuncture is good to chronic pain, but currently we just proved acute pain is working is very well.
Okay.
So it's
So after
again,
one session,
yeah.
does the patient experience relief right away?
Yeah, some acute pain, especially someone who has a muscle spasm on your back, on their back, and after one time acupuncture maybe relief very fastly.
Okay.
Yeah.
So now we've piqued their interest. Now they're interested in essential oils. Maybe essential oils can replace all the medicines in our medicine cabinet. Maybe we'll talk about that when we return on the show. Plus acupuncture as well. Don't go away.